Welcome back. Right now, health experts say it is hard to fathom the true impact of the coronavirus on the United States without proper testing capacity. According to a new article from Politico, there's a strong likelihood that states are severely underestimating the size of their outbreaks. Just yesterday, the White House reported that 1 million people have now been tested for COVID-19, and the country's labs are now processing at least 100,000 samples every day. But according to reporting from The Atlantic, in the U.S., only about 320 out of every 100,000 people have been tested. We know that the state of New York, and New York City specifically, have become the epicenter of the U.S. outbreak, with more than 1,000 COVID-19 related deaths. But New York also has the nation's highest testing capacity right now, which leads to a better understanding of the virus's impact. There are now growing numbers of hot spots emerging across the country in places like Louisiana and Michigan, where testing gaps are crippling efforts. Here's an example for you. Michigan, which just opened its first drive-through testing site this week in Detroit, saw its number of confirmed cases jump in the thousands in just one day. Michigan now has the country's third most cases, but its per capita testing rate is less than 1/3 that of New York's. And without a handle on testing and the ability to analyze those tests, it is critically impacting a crucial resource in this country of personal protective equipment, or PPE. If a patient enters a facility with COVID-19-like symptoms, healthcare professionals must act as though that patient has the virus, since the test is the only way of knowing for sure. That means utilizing masks, gowns, gloves, and other PPE until that test comes back negative. And while those workers are waiting for test results to come back, if it does come back negative, it means that they used PPE supplies when they weren't needed. Health officials say testing blind spots not only makes it harder to slow the spread of COVID-19 because we have no idea who's carrying it, but those blind spots also make it tough to know when it's safe to ease social distancing measures.